Hi everyone. Today I want to talk about cancer and some things related to cancer which I found based on my own family's history of cancer. And I hadn't reflected on this history when I was growing up because I was a small child and I was not thinking about diseases or anything. But after having gone through some pre cancer symptoms in the last few years, which I have managed to now control using different mechanisms of preventative care, there are some basic principles about cancer that I learned over my own history of trajectory of that disease condition manifesting in my body that I wanted to make this video. And first, let me start with my grandmother's history. Then I will talk about my history. I have mentioned a little bit about my history in my previous videos, but I will reiterate some points again in order to hopefully make you understand what the purpose of this video is, which is that cancer usually develops from, firstly, we all know this, but we don't mindfully observe this in our life, that cancer develops from carcinogenic chemicals in our life. So if our life has conditions of health, conditions of living which supports cancer, then cancer will develop in someone's body. And if their lifestyle, what they do daily, or what is happening around them in the place they live doesn't support cancer causing conditions, then they will be less likely to get cancer. Or even if some cancerous cells are developing or cancerous conditions are developing in their body, if the number of carcinogens, if the kinds of carcinogenic exposure is less or reduced, your chances of cancer developing will be either reduced or slowed down, or you won't get cancer at all. That's why if in the same area where some carcinogens are present, multiple people live in that area, they all don't get the same disease. If anyone watched the movie Erin Brockovich, and even if you haven't watched it, you might use that movie as a reference guide, because in that movie she was fighting the case against a company whose industrial effluents were causing the water of a particular city or whichever area she was talking about, because I have actually forgotten the movie. It's been decades since I watched it. But the main salient features that I remember is that Erin Brockovich was fighting about water pollution problem, which was impacting the health of multiple people in a particular locality who were getting their water supply from a place where some industrial dumping of water effluents, polluted water was happening. And now water pollution is a main earth health impacting factor that everyone kind of disregards, because all of us assumes that the water that we get from our underground water supply or from our municipality is pure water. And that was true when we had pure earth living conditions on earth. It was true maybe 30 years back, 40 years back, when someone living in a particular area actually had clean source of water. But over the time of human existence in any area, human activities causes also water pollution. Not simply activities outside our home like the Erin Brockovich movie was showing, but activities in our homes also impact our water quality and water supply. And this is why cancer and many water pollution related diseases are manifesting in people's bodies. It's just that some of these diseases manifest slowly over time. As a result, people are unaware about the consequences of their own choices that are impacting their health. And there is a collective effort that needs to happen globally by many of us if we want to go towards a better health trajectory. Now, coming back to my family history, which I hope will help you understand how pollution from not just water but pollution from different sources can cause someone to fall sick and also can lead to their death. With my grandmother, when she was diagnosed with cancer, I was in my teenage years. And when she passed away, I think I was in my 10th standard. Now, before she passed away, when her cancer was detected, she did get good treatment in one of the best hospitals in India. She lived in West Bengal, but because my dad had some friends who worked in this, who had contacts in this hospital, she was able to get access to care quite relatively easier than many other millions of Indians who sometimes can't get the access to care to this hospital. The hospital there that she got her treatment from, and this was around 1990s of India. She got treatment in Tata Memorial Hospital in Mumbai, and her treatment regimen included, I think, definitely a surgery had happened because she had esophageal cancer. So her esophageal tract had cancerous cells, and a section of her esophageal tract which was above her stomach, that area was cut off. This is what she explained to me, or my family explained to me, when her disease and her treatment was going on. And not being a doctor and not working, just being a simple child, I never asked patient history. But now that I have studied different elements of patient care, healthcare as a pharmacist, when I was also studying a clinical PharmD degree program in US, I had to learn what are the factors that influence a patient's health when they are getting treatment also in a hospital. My knowledge comes from US healthcare, but those are the current trending basis of healthcare treatment regimens that are upcoming in US. And even then, what I'm talking about, what I understood about what healthcare is from almost 10 years back when I used to live in US. Currently I live in India, but what I see in India is that Indian healthcare system do not have that same level of upgradation, same level of depth of understanding of patients' diseases as some places in US have. Even US healthcare doesn't have a complete comprehensive picture of what needs to shift in healthcare currently, because of which I've also seen many patients even in US healthcare who have had to go to doctors for 1, 2, 3 years before their cancer or their multiple health issues could be diagnosed and detected by their doctors. The reason for all this lies in multiple things, and it's a very big comprehensive topic. So for the US healthcare related issues, I will make another video, but it is not a problem that is unique to simply US patients or simply India patients. It's a problem that is manifesting globally. That's the reason why many COVID patients also died, because people don't understand how even COVID happens at the deeper level. People have a very superficial view of COVID. That's why also there are still many long COVID patients as well. And this video is designed for people who have had long history of suffering without getting meaningful resolution, either from medical interventions, or even if they did get medical interventions, people also died despite the currently known norms about medical interventions. And the reason for them dying also lies in all these factors related to earth pollution that I have mentioned in my previous videos, and I will try to tie them together in this video as well. So with my grandmother, she got treatment in the top class hospital of India, Tata Memorial Hospital, which treats cancer patients and has been treating cancer patients for decades of their life. Now in this Tata Memorial treatment, her esophagus, which had the cancerous cells, had been sectioned off via surgery, and then she either received chemotherapy or radiation therapy. I don't remember her supplementary therapy because I was not paying attention, and that's why I don't remember which one she got or whether she got all three. But I do know she had more interventions than simple surgery, and I also had seen her take medications for after her surgery. So when she was living after her surgery had happened, and even before her surgery, for at least 5 6 months, she lived with us in Mumbai. At that time, because she was missing her family, after her surgery, after a few months of her surgery, she moved back to West Bengal where she originally lived, and she went back to her original home where her husband and her other son lives. Now the thing is, though I didn't understand this as a part of impacting her health history, it's only in recent years, from my perspective and from my understanding of what was unfolding for her in her health, that I observed in her health, I'm realizing that part of the reason for her cancer was there in her normal lifestyle choices. Because one of the symptoms before her cancer was detected was that she was regularly vomiting some small, like in Hindi that word is called dakar, when we give, like, this burp that causes some acidic effluents to arise from our stomach up our throat and sometimes out of our mouth. That kind of burping that is acidic, that happens to many of us commonly in India, and it's termed as acid reflux if it is happening regularly to something like that was happening to her. But it wasn't exactly simply just acidic thing coming out of her mouth, but she was literally vomiting something out regularly. Some liquid was coming outside from her stomach, and this liquid thing that was coming up, because she used to live in a house where we one of my uncles was working in a pharmaceutical industry as a representative. So he had access to medicines, he had access to doctors who could see her when she was sick. So despite that access, initially most doctors just probably ignored her symptoms and likely just gave her some symptomatic treatment for her acid reflux like or vomiting like sensations. But if simple medicine could solve her problem, would she have developed cancer? No. Those medications that help people with acid reflux, those medications that help people with their nausea or vomiting, those are temporary intervention medications when you have temporary health issue which is occasionally arising in your body. But when someone has a chronic problem of acid reflux, chronic problem of nausea, vomiting surfacing in their health, it means usually that something in their daily lifestyle is impacting their health. And this analysis was not done during the time when she fell sick, because this kind of analysis doesn't happen in most patients' healthcare analysis by anyone in any system of healthcare, except maybe Ayurveda does that a little bit in Ayurvedic regimens. That, or if you go to a nutritionist might help you in understanding what in your nutrition is impacting your health in some symptomatic ways. But except for nutritionist related practices or Ayurveda related practices, and if some internal medicine doctor is also practicing a good nutritive supportive care regimen and giving those advice to their patients, then only some patients are doing the right adequate nutritional support necessary for keeping their health at a optimal level. And there are also people like me who are independent oriented, and we take our health seriously, and hence some of us also eat the right foods related to our health from the knowledge we gather, or we have gathered from our family, knowledge we have gathered from our doctors, knowledge we have gathered from our own understanding of our own health. So these are the types of patients that a doctor sees: someone who's really mindful of whatever health supportive factors they should have in their life related to physical, mental, emotional health, someone who can be doing and operating at that optimal level of health. And there are other people like my grandmother who are unaware that what is optimal health, and she just follows the guidelines of whatever the doctor tells her is the right guideline for her health. So even though she saw a couple of doctors a few years before her cancer was detected, it took a while for this cancer detection to happen, and in that meantime she kept suffering the same symptoms before her cancer manifested, because the carcinogens in her environment that were leading her to her cancer were continuing. Because if you take a medicine, say, and that medicine is stopping you from getting acid reflux or nausea and vomiting, if these are your three main symptoms, and some gastrointestinal problem or some esophageal problem is developing in your body, that's when you're getting these three symptoms. But whatever chemical or whatever biological thing, or because acid reflux can happen from chemical poisoning, acid reflux can happen from biological toxins. So these are the two common ways you can get the acid reflux. But while biological toxins have been examined quite a lot in our medical literature, and as a result, we do have some acid reflux treatments. If your acid reflux is from H. pylori, you will get some antibiotics too as a part of your treatment regimen. But when your doctor is aware that you have H. pylori infection, when you are aware you have that, or when a test has detected that you have that. Otherwise, doctors will only give you standard antacid medications instead of giving you the bacterial thing needed to stop the acid reflux that is surfacing from a bacterial infection. Right? Like that, if your doctor doesn't understand if you're getting acid reflux or any other nausea, vomiting, and gastrointestinal symptoms from a chemical toxin, if the doctor doesn't know it, you have not observed it, there is no way for that information to come out until enough people in a particular place have fallen sick from the same things, which is what happened in the Erin Brockovich movie. There were thousands of people who were impacted by the water pollution of a large area. But does that mean until the time Erin Brockovich fought her case, all the patients who were suffering, did their suffering stop if a doctor didn't realize it, government didn't realize it, the industry from where the effluents are coming, if they don't realize it, until they don't realize, any of them don't realize it, does it mean that the people who were living in that area stopped suffering? And Erin Brockovich got a hold of those patients who had complained and who were severely ill, and that's why she had that information. But otherwise, apart from the, and she also went around, I think, checking and finding those patients. But if she didn't do that, there are so many patients possibly that she even couldn't even reach via her own efforts, because there are many people who are also the meeker kind, self-caring kind, independent kind, or the kind who, if they have gone to a doctor, the doctor ignored their symptom, gave them something very, ignored meaning if their symptoms were at a milder level, doctor thought it is a mild level disease and they let them go. Or the patient themselves thought that it is just a common flu, it is just a common vomiting, it is just a common skin irritation, because water pollution problems can impact you in multiple levels, and multiple different organs can get impacted. For different patients, different organs, different bodies functioning will be impacted. So the mild symptom or moderate symptom patients, even in that tale, which is a real story based on a real woman's journey, didn't actually cover all the patients who actually got impacted via that water pollution problem. In fact, some of those patients who even got some relief via the class action suits, some of them in their own families, there might have been other family members who might have also been developing cancer and organ damage and other symptoms slowly in their body, because maybe they were relatively at a higher level of health than the one who was the most impacted by that water pollution. So even if, say, there was a family of 4 and one person in that family got impacted by a disease for which they got compensation, it doesn't mean that the other 3 members in that same family didn't have any water pollution related impact on their health. they were also getting impacted. Their health got impacted in a different way. And then those people, if they had something like cancer or organ damage developing, those things take long time to develop in a body. So during that class action suit period, they might not have had any symptoms, or they had possibly milder symptoms, but they also could in the future have had consequences from being exposed to the same water pollution of that area. And like that is the problem with anyone on earth currently who has water, air, earth, food, clothing, shelter, any kind of pollution going on in their life. So with my grandmother, even though she got chemotherapy, even chemotherapy, radiation therapy possibly, and definitely she had surgery, she died 2 years after her, 1 to 2 years after this surgery happened. And in that time frame when she died, I had observed for a few months, two times. One time she was staying with us post surgery. One time I had gone to visit her during some family event, and I had observed that she was, after 1 year after her surgery, also she had bone ache and pain going on. The medicines she was given was not working for her. I remember, massaging her and like giving her a body massage because her whole body was hurting, and she was in great pain. She was also the same symptom that she had before her surgery of vomiting out, spitting out things from her stomach, and most of the time she was not able to keep also food in her stomach, so she had started eating lighter meals as well. Despite that, she was spitting out and vomiting things from her stomach. And most of the time the spit that was coming out for her case, when I had observed her, it, because she was eating light meals, it was only something liquid that was coming out. It wasn't a meal that was coming out from her stomach. And that liquid that was coming out is the similar liquid that comes out when someone has acid reflux, is also this kind of liquid that will come up when someone has something called arsenic poisoning. And why am I correlating arsenic poisoning to her health is because many of her symptoms correlated with arsenic poisoning. If you continuously get exposed to arsenic from your food supply, which is what was her cause of her arsenic poisoning, it was coming from her food supply. And this knowledge about the food in West Bengal getting poisoned by arsenic was something that had come in the newspaper of West Bengal, has been a common knowledge for doctors and practitioners in West Bengal or all over India for a long time. This is knowledge which is old knowledge, that arsenic was found in West Bengal related rice long time back. In fact, in a recent article from a few years back, I also found an article which showed currently that arsenic is found in rice all along the Ganga belt. So this thing of arsenic, why is it been found in those rice? First of all, rice is a staple food of northern India or whole India. Rice is being eaten by majority of Indians in at least 1 or 2 meals of their day. And from that rice production, that's why is one of the most cultivated crops of India. And in that, because for decades humans have been using chemicals to increase their productivity, pesticides, fungicides and other chemicals are regularly used in our crops. Arsenic is also found in pesticides used farms more than if you weren't using pesticides. So there is a correlation of pesticide use and arsenic that has also been found. But despite that, people are not understanding that you need to stop putting pesticides in your crops because it impacts the health of everyone involved. The farmer who is growing those crops, he will also be eating that rice. He also will get arsenic related poisoning. The person he is selling it to, they are handling the crops. They will also get some poisoning from just handling of crops with arsenic in it. The person who is cooking will get it. And that's why my grandmother, who was the cook of the family, the main cook of the family, was getting the most poisoning from having washing the rice, from cooking the rice. And in our family the system was that first the men and children would eat, then the woman eats. So when she's eating the rice, she's eating the bottom part of the rice, which will have, when you boil rice, if anyone has boiled rice, you know that starch is there in the rice. And the Indian way of cooking rice is we drain out the starchy water. But if say you had added more less water to your rice, and if the starchy water is very thick, what will you observe? You will observe that the thick bottom part of that rice will always have some starch remaining, even if it is thick water, even if it is thin water. Because we are not usually filtering out that rice, we are just draining out the water, some starch always remains in the bottom of the pan. And that starch will invariably have a little bit of whatever contaminants that the rice had, those contaminants will also be there in the bottom. So if the rice has arsenic, a little bit of arsenic will be there. If the rice had other chemicals other than arsenic also, all those chemicals are there in the bottom of the vessel in which the rice is cooked. And whoever is going to eat the last meal invariably is going to get the most toxin from that rice, right? Same thing with any other food you cook in water. If your water has water pollution related problems, whoever eats the most of the water pollution related chemicals will manifest the most symptoms from the water pollution used water, if you had used it in your cooking. And if water pollution is rampant, not simply in your cooking, it is there even in your bathing water supply, then your water pollution related problems are happening from you having bathed in that water, taking a shower in that water, washing your face in that water, and your body is absorbing it via the water, whatever water soluble chemicals are there in that water. If our body, if we love to use lotions and oil, then our body is also absorbing all the oil soluble chemicals from the water into our body. So this is how toxins can keep on building in our body, that impacts our health over long time of small toxins getting absorbed in our body. Now with my grandmother, because I feel currently that she was getting her cancer developed from arsenic poisoning. And there is a very slow trajectory of arsenic poisoning, because it's not that a large scale amount of arsenic went into her food, but every day that she was eating the same rice from the cooking that she's doing, and she being the last member to eat that rice, she's always getting more arsenic than anyone else in the family when arsenic is there in the rice. And let's assume that arsenic is the source and the only source, because I'm sure that there were other sources also that caused her health issue, but arsenic was one of the sources. Because at that time also, I remember when I was a child, I remember my nails having these white patches on my nails. And only later when I had studied about arsenic poisoning, I realized and remember and correlate that I was also getting symptoms of arsenic poisoning. I also had those white patches on my nails which showed arsenic poisoning. Other people in my family were getting other symptoms, for which some people in my family used to get acid reflux, and they would take medicine for their acid reflux, right? So different people were getting also some impact of the arsenic from the food. It's just that because I was only visiting that neighborhood and my family once every couple of years, so my exposure to arsenic from the rice used there was less. If there was arsenic in the rice that I ate in my home in Mumbai, again I would get that. And there was invariably some arsenic even in our home's rice, most probably, because I didn't have these white patches on my nails simply when I was living or visiting them in West Bengal. But even as a teenager, when there were a few years, like in India, when we are giving 10th exam, 12th exam, or we are in college, we don't usually travel a lot. We are focusing more on studies. So the 4-5 years of my life when I didn't visit anywhere, I was only eating food in Mumbai. At that time also I got arsenic related symptoms on my nails. So that's why for my grandmother, I saw her after her surgery vomiting. Even in before her surgery also I had seen her vomit. After her surgery also I had seen her vomit when she was in Mumbai. And during the 2 years post surgery also, she suffered the same or similar symptoms despite the cause of her cancer being removed. Because here is the thing where medicine also has to shift. If the root cause of a patient's problem is not stopped, if the root cause is still there in their environment, will your symptoms stop? No, your symptoms will stop if you take a medicine to stop the symptom. But even if you take the medicine from stopping the symptom, first of all, if it is a harmful chemical that is impacting your health, the chemical is going to continue impacting your health, which is what happened to her. Prior to surgery, even if she took medicine for her vomiting, nausea, and acidity, they only were stopping her symptoms, but the arsenic that is there in her food was continuously acting on her gastrointestinal tract and eventually led to those cancerous cells forming in her esophagus. And after the surgery also, because the arsenic is the root cause of her vomiting continued, it didn't stop. And because the root poison was not still continuing in her body, eventually, for whatever reason, her health gave up and she passed away. Because that same arsenic, if it is continuing in her food, along with arsenic, if with other chemicals also got added to her body, being a weakened cancer patient now, she is not able to take it. That's why she was getting bone ache and pain. Bone ache and pain is also manifestation of possibly another kind of cancer developing in her body. The same another kind of cancer which can develop from arsenic and other chemical exposures in her environment. As a result, eventually her body couldn't take the load and harm from whatever her body was suffering from, and she passed away. Now, whatever her final cause of death was given by a doctor, I don't know. All I know is she passed away. But now, coming back to family history of cancer, I will now shift gears. And in my grandmother's tale, from my grandmother's tale, at that time I didn't understand this. Now I am understanding it, because there was a full family history of many people dying from many diseases who had medical interventions like my grandmother for the particular disease they were undergoing at that time, that was diagnosed by a doctor, that was treated by a whole range of doctors for some people. But despite that, despite medical professionals treating these patients, they still died and died within a couple of years of those interventions happening, because the root source of their health problem hadn't gone away from their life. And in fact, after a surgical and medical intervention, their body got further weakened. And then, as the result of the further weakness from an intervention and the weakness from the toxin that was impacting their health continuing with them, they eventually died because their bodies couldn't take the toxic load of the toxins. And for my grandmother, the main toxin I realized was arsenic. Then maybe I should talk about the other person also in my family. But I will talk about her health in a different video, because it's a different disease condition that manifested. But it also is a disease condition that has been manifesting for many people in my family related to that side of the family. But from my grandmother's side now, I'm going to switch gears to my dad. Now, 30 years back, people thought, during my grandmother's time, you treat a cancer, you give a medicine for cancer, you give a surgical intervention for cancer, you give radiation therapy for cancer, people will survive. That's true, some people do survive it. A person who survived this cancer, his cancer was my dad. So now I'm going to switch to my dad. With my dad, his cancer got detected after he got retired, a few years after retirement. And during the time he was working in a nuclear power plant facility. And some of his work interventions involved him entering a nuclear power plant for the kind of work he used to do. Because of which, when his cancer was detected, he had colon cancer. And his colon cancer, when it was detected, everyone assumed that because he was working in a nuclear power plant, and many other people who have been working in that same facility have also had some either colon cancer or prostate cancer. Even now, many of his colleagues who have worked in similar settings as him, I know a few of my dad's past colleagues who still live in Navi Mumbai, who live in different parts of Navi Mumbai, who live in same area as him in Navi Mumbai, and they have all manifested lower body part cancer of either the prostate or the colon, because when you are working in a nuclear power facility, even if you are wearing a dress that protects and shields you from some of the radiation, a little bit of radiation can still invariably penetrate and go into these organs. That's the reason why they got the cancers they got. But if everyone assumes that the only cancer causing element in their lifestyle was the fact that they had radiation exposure from working in a nuclear power plant, is also a false paradigm. And on that I will talk when I will talk about my health issue. So with my dad, he also, because he had a colon cancer, he also got a surgical intervention as well as chemotherapy. I was present during his chemotherapy part. I wasn't there during his surgery part. But these are also again standard protocol for cancer patients. You will either have, if you have something that can be surgically removed, that thing will be surgically removed, and then a chemotherapy or radioactive therapy would be given depending on what kind of cancer do you have and what is the standard regimen for that cancer. But my dad, he has survived his cancer. It's been over a decade since he got his cancer. He survived his cancer. He was able to survive his cancer because when his cancer was detected, which was almost 20 years after his mother's cancer was detected, for him, he was living in Mumbai, and his social setting of food and nutrition was partly different from the social setting of food and nutrition that my grandmother had access to. Food, nutrition, water, air, all these things impact our health. So for my grandmother, whatever was the factors that were impacting her health, while my dad was living with them, those were the same factors that impacted my dad's health too. So for him also developing this colon cancer, part of the reasons for his colon cancer was also the arsenic that he has consumed from a long time back. It's just that its impact was maybe milder in his gastrointestinal tract, because he was not living always with the grandmother. He went away for studies, he went away and for a job eventually. So at that time, and initially when in pesticide use wasn't common in the village areas of any country at that time, many of people from my grandmother and dad's generation have also been lucky to not have pesticide exposure, arsenic exposure from their food. So they had, that's why, a relatively healthy life when they had the cleanest earth possible compared to any one of us who is living now, who hasn't lived in those clean circumstances. But my dad, having lived in some cleaner circumstances, his cancer took longer time to develop. We living in Bombay maybe had different kind of food access, less chemical laced food, and my mother was a more careful cook also than my grandmother. My grandmother was a very quick cook, so she would quickly cook. So if say, which I had observed, I have not observed mindfully the very vast differences between the cooking of them, my mother and grandmother, but I know my mother was very careful about washing and cleaning and washing off and making sure that the food is more hygienic. So if there are two women who are cooking, if one washes the rice only one time, and they both buy the same rice from the same source, and they both the rice have same quantity of arsenic in them, what will happen is the woman who is washing the rice more carefully and more times will eliminate the arsenic more from their rice. So definitely, if you are eating in the hands of a person who is cooking more carefully, you are naturally going to, woman or man or anyone who's cooking, if they are more mindful cook, if they have the same source of arsenic also present in both the rices that are being eaten in two different parts of India or two different homes even in the same part of India, the one who is doing more of the cleaning, more of the careful cooking, will definitely keep a better health in their home. So that's why my dad, if arsenic was also partly responsible for his cancer, he didn't get it because for 20 years of his life, his wife was cooking for him more carefully. right? Because my mom passed away when I was 20, so about 20-21 years of my dad's life. My dad had for 21 years a wife who cooked more carefully for him. As a result, his cancer also took 20 more years to develop. If only arsenic would have been the cause of his cancer, but only arsenic was not the cause of his cancer. He also had exposure of radiation. So for him there were at least minimum two chemicals, two environmental conditions that led to his cancer development. Now coming back to his cancer trajectory. Now after cancer also, why did he recover also better? For two reasons. He had got his cancer detected when he was in Navi Mumbai, which is a little less densely populated part of Mumbai, which had, at that time when he moved here, at that time it had more greenery, so more access to clean oxygen, more access to clean water, because it was a new municipality, new setting. So he had better access to clean water, better access to clean air, better clean foods were available here, because at that time Navi Mumbai was much less densely populated than it is currently. So he had, and same way it was much less densely populated than the place his mother lived, and also the place where my dad was working in BARC, which is near Chembur Trombe area, in between Chembur and Trombe of Mumbai. So even BRC had a much more greener environment. So the greenness of the environment, the clean water supply even in BRC, all these factors also impacted my dad's overall health trajectory. So it gave him a better resilient body, because nutritionally and environmentally he had access to much more clean water, air, food than my grandmother had access to. So when he had cancer, during his treatment regimen, he had one short treatment regimen of only 3 months or something, and after that, whenever they have done follow up for the last 10 years, he had a clean gut in the colonoscopy that he was doing regularly as a follow up checkup. But while in these 10 years trajectory, what has happened to the place where he is living? The society where he lives has now become more densely populated. Not just the society, but the whole neighborhood has become densely populated. The number of people living here has definitely passed at least like 10,000 times more than the number of people living here when he initially moved, because there are so many new constructions, so many new buildings that have come up, new malls have come up, new schools have come up. So everything related to civilization's growth ends up impacting the overall environmental pollutants of that area. Depending on what is going on in school, if you have a high school where chemistry experiments are going on, that will impact your chemicals in your air. If you have a mall near your area, lots of people are traveling to the mall for shopping, again the chemical impact of traveling will be there. If there are people who are coming to the population itself has increased, all human activity related pollution then increases in the air, water, food, everything, right? So now my dad has, in his last colonoscopy where I was there, at that time I saw that in his colonoscopy there were some lesions detected. Now just because he goes to a government hospital, that government hospital had a relatively younger doctor seeing him. That relatively younger, newer doctor didn't consider this as a red flag, that when you have lesions developing in your colons, that is a time when you have to give some treatment so that the lesions don't get converted into cancer. And this is the thing, sometimes doctors may have read it but studied it, but they forget because they are new doctors, they don't know in their practice that this should be commonly followed. So she hasn't done that due diligence, that this patient needs to be watched, because not just lesion, any patient who has developed lesions in their colonoscopy should be watched as such a little bit more carefully now. But my dad also has a past history of cancer, so he should be watched even more carefully, but he wasn't. And even though I have this information, I also have a very patriarchy oriented father who thinks only doctors have the right information. People who have other healthcare information knowledge do not have the right understanding of healthcare. So he being ignorant about my knowledge, ignores my knowledge. But I can't do anything about it. If he ignores my knowledge, if he ignores that he needs to do a better follow up of his health, he needs to start following some better healthcare regimen if he wants to survive through a potential development of second cancer. There's nothing that will stop his lesions from going into cancer if he continues eating the kind of food, because of air pollution, because of water pollution, because of food pollution, because of environmental pollution. Many factors are now present in his life that were not present 10 years back, that were not present 20 years back. My mother's cooking that was present in his life 30 years back, that cooking level is also not present in his home right now, because the cook that he has hired is someone who is not ready to mindfully cook. She cooks good food, but she cooks fast food. She's like a fast cooker. So, like, fast. It sounds funny, but she is like that. She's like a pressure cooker. She's always under pressure because she works in different homes and she takes the stress off. She just wants to get done with his cooking, and her health is also deteriorating from the environmental pollution. So, it's very natural that she will start being stressed about her job because there is a main water pollution problem going on here. And like her, she doesn't like to cook more than 15 to 30 minutes or maximum 45 minutes in a kitchen, depending on which home she's cooking. In our home, me, my dad, my brother, we are all light eaters, or even if we are not light eaters, we can do with light cooking. So she does this light cooking of 30-40 minutes and leaves. 40 minutes is the max she will go if some extra cooking is given to her. Otherwise, within 20 to 30 minutes her cooking is done and she will leave. So, but why is she getting into this zone, in a pressure cooker zone with cooking, is because if there is water pollution, and this is common in every one of us. When we were growing up, many of us used to directly cook with tap water. My mother has also done that. My grandmother have also done that. We didn't have any filtration systems in our homes until recently, and these filtration, because we didn't have filtration systems, all of us in our home have been cooking directly with the tap water that we get. And in my grandmother's case, they were having tube well and well water, so they used to cook from the tube well and underground water of that area. So my grandmother had the most poisoning, both from the arsenic laced rice that she was eating, but also the water. If the underground water had some contamination, while those contaminants were also present in her cooking. And Indians love to eat boiled food. Indians who are minimalistic, who are not very rich food oriented, and my family is a very simple village family from father's side, so we don't like eating too much of rich food also. So most of our cooking will have a little bit of oil, but most of our cooking also is just boiled cooking. So as a result, if water pollution is there, anyone who wants to eat healthy, anyone who eats minimalistically, anyone who has been taught that boiled foods are the best foods to consume, it is true, boiled foods are the healthiest foods to consume, but only if water pollution was not present. If water pollution is present, then that water pollutants in your tap water, pollutants in your underground water will cause health harm. Because what is happening, say there are 10 molecules of a chemical in 100 ml of water. When I am boiling that 100 ml of water while making dal, say that 100 ml water, say while cooking the dal, it gets reduced to 50 ml. Now for when it was 100 ml, there was 10 molecules. The ratio of the chemical in it is what? 1:10. But when now it has been reduced to 50 ml, the ratio has become 1:5. So the concentration of the chemical in the food is doubled now, just by simply reducing the water. And like that, every time, it doesn't matter if there is a larger family, then the whole chemicals get distributed in the larger family. But if it is a smaller family and you're only cooking for yourself or only for 2 people, the food that you're cooking, only 2 people are eating, they are eating the most chemicals in the food, right? Everyone who is eating it is getting it. But because there are chemicals in those same water, anyone who's cooking is also absorbing it via the steam, via the inhalation pathway as well, which is why this cook is always in a pressure cooker zone of running away. But will her running away solve her problem? Her wanting to learn mindful ways of cooking will solve her problem. Everyone waking up to mindful ways of cooking will solve the problem. Everyone realizing that water pollution is happening and then stopping all water pollution related problems will stop the problem. Otherwise, what will happen? All of us are going towards some slow developing cancer, organ damage. She has also the acid reflux problems, and something that shows that she also has slightly arsenic poisoning going on with her, because she was eating all her life. She has eaten rice related kurumura, puffed rice, because she's from a poorer family. Puffed rice and rice are the common things people from certain socio-economic backgrounds eat regularly. So if arsenic is there in rice, it will be there in puffed rice as well. If arsenic is there in rice, it will be there in all rice products that people eat, most of the rice products. Even rice bran oil has arsenic, and I have had issues with rice bran oil. I'll talk about my health next. But with my dad, all the careful cooking, careful healthy health environments that has helped him lead a good life until now, he has been one of the luckiest person. He doesn't consider himself the luckiest person, but if you look at environmental health conditions, the conditions that supported his health, there were many conditions present in his health that supported his health and led him to lead a good healthy life, and even a relatively healthy life for 10 years after his cancer had shown up and he had recovered from the cancer. But during these 10 years, the first few years, he was very careful, because doctors were also very careful. They were doing once a year checkup, once in 6 months checkup, and they were very mindful. But now, because 10-year trajectory has passed, what happens in India or any other place, after a while the doctors will move. The ones who knew the patient history, old patient history, goes away. When the old patient history knowing doctor goes away, other doctors, if they are newer doctors, they will be too much in pressure of just learning the ropes of the job. That's why they might not be as mindful with a patient. If they are not a new doctor, even if they are an old doctor, because they don't know the severity or whatever of the patient's history, sometimes they will casually look at the patient reports and let it go. So depending on the mindfulness of the next doctors only, the quality of care will be better for my dad. Same way, mindfulness of not just doctors. My dad also has got to be mindful, but he is the least mindful person. That's why one of the luckiest people, because all his health supportive things that happened to him happened organically and naturally around him, based on the people who lived in his life, the quality of work those people were doing. But when water pollution is impacting my dad's health, his cook's health, it is also impacting my health. None of us are able to cook mindfully. None of us are able to focus mindfully into cooking. Is his health going to deteriorate? Yes. If the doctor is not careful, he is not careful, his cooks are not careful, he cooks partly for himself also. I had to literally fight with him for 4-5 years before he has started now using filtered water for his cooking. But in filtered water also, there is now one problem. Every time our machine breaks down, the filtration device company brings whoever comes as a technician to do the cleaning of the filtration device. Our earth has now, which is a chronic problem of every man who does a job or every woman who does a job without care, without mindfulness, without self-awareness. People, there are two ways to clean the pipelines of our filtration devices. You can do the slow way, where you slowly pass the water, see that nothing is blocked in all the pipes, and you just replace the pipes if the pipes are blocked too much. But in India or globally, everyone is in the cycle of, I want to do quick work, fast paced work. So what do people do when they want fast paced work? Men in general have this trajectory of, every time you have some problem, let's mask it or let's clean it up by giving a medicine to it. So they put some chemicals even in our pipes of the filtration device. So nowadays, whichever time in the last 3-4 times some technician has come to clean the pipes, the chemical content in the water that I get from these filtration devices is high. So if someone has cancer from chemical carcinogenic substances, someone has organ damage from multiple chemicals harming their body, someone has some kind of say multiple system failure happening in their body, someone has their blood which has got poisoned from chemicals, someone whose skin is poisoned from chemicals, if I drink this water with filled with chemicals, am I going to have good health, or is my health, if I have already poor health, is my health going to deteriorate? Because every single medical intervention, to yoga, to energy healing, to taking even a small supplemental drink for health purposes, to taking a medicine for health purposes, everything needs clean water. If you have even fever, if I want to reduce my fever will only reduce if I wash my body using a cloth which is dipped in clean water. If I dip my body in a cloth which has contaminated chemical laced water, and my fever is coming from chemical pollutants in my body, I'm adding another layer of chemical, my body will not bring the fever down. Same way, if the washcloth that I use for trying to bring my fever down, if a mother is doing to a baby, that she has learned this practice that keeping a cool cloth of water will help in bringing the fever down, or putting some ice in a cooled wrapped up in a cloth, and we will put it on our body to bring the fever down. But here, do you see where are the different places where chemical pollution can impact our health? If that ice itself is formed with chemicals, that getting absorbed in my body will also be harmful. If the washcloth that I am using, if my water supply in my home is filled with chemicals, and regularly I'm washing this washcloth because that's something I use regularly. Say you're in a hospital also, and your hospital also has its own laundry system where all these clothes are getting washed. If that laundry system's water supply is contaminated, all washcloths are contaminated. Everywhere you go, water pollution, without water pollution you cannot survive. If water pollution is there, you cannot survive. This is what I mean. With water pollution, you cannot survive. If water pollution is there in multiple levels of your life, you will get worse and worse in health. And this worsening of health to someone who is severely health impacted, like my grandmother, caused her to die immediately. I am also as severely health impacted as my grandmother and my father, and even my mother, and I'll talk about my mother's history later. But even though I'm health impacted by all of them, and even in fact worse health status than them, my problem is when I go to a doctor, because I look like a fit 40-year-old, and because I am a 40-year-old, no one understands that I am sick. I understand it because I am feeling the repercussions of those small symptoms developing in my body. And even if they don't realize it, I also have the clinical knowledge to read my clinical reports. I had done a PharmD program. I didn't finish it, but I had, just by doing those programs that I have studied and done via different layers of studying regarding health and healthcare in pharmacy field, I understand some of my medical reports. I don't remember it because I don't practice it. So if any doctor comes and wants to challenge me about his knowledge, maybe that doctor's knowledge will be great. But what I understand is, if doctors are not able to detect some disease in a patient, all I have understood from my own disease condition manifesting, or the thing that is manifesting even in my dad, or the things that are manifesting even in our cook, all those subtle symptoms of health status changes are which are indicative of something going wrong in their environment impacting their health. This aspect I understand because I'm an observational mindful person. And second thing is, if their reports were given to me, or my own report I studied, I eventually found out from my reports that yes, my body is near cancer level. Yes, if I also had a lesion in my thyroid. Now that lesion had developed initially, it was a nodule. That nodule has converted in 10 years time into a lesion, and that same lesion has potential to again in 10 years time convert into cancer, or even right now in 2-3 years it can convert into cancer if enough carcinogens are present for my thyroid lesion. So what did I do to prevent that thyroid lesion to not escalate? I had to first realize what are the things that are impacting my health. The thing that was impacting me was radiation. So going out in the hot sun was impacting my skin health, because that also happens if you are going towards thyroid cancer or thyroid organ malfunction. Your skin will start showing sunlight sensitivity. So that happened, but I didn't just have sunlight sensitivity, I was having getting sensitivity even when my phone's radiation levels were high. So when my phone's battery life is low, my phone is heated up, its radiation level is high, I avoid using my phone. When I was getting also these small LED lights that have come up, even though they are low wattage lights of 8 watts, 10 watts, 20 watts, even from those low wattages, I am getting the heat and radiation that comes from these lights. It caused my skin to be very, it gave me a very burning sensation. That burning sensation, which was detected in the form of heightened inflammation in my body. So my immunoglobulin levels were high, my inflammation levels were high, my allergic responses to not just radiation but allergic responses to different chemicals in my environment was high, because I had another kind of cancer also developing in my body. Now both of them I can only keep check if I stop the carcinogenic chemicals from impacting my health. Any kind of chemical that is impacting my health, I have to stop getting exposed to those chemicals. Any kind of radiation impacting my health, I have to stop getting impacted by those radiations. And the things that I have a choice to not sit under the LED lights for 20 hours, because that's what I used to do sometimes. I would be using LED lights all through the night, only during the 4-5 hours of the night when I'm sleeping, or 10-20 hours of the night when I'm sleeping. Sometimes my lights would be off, but sometimes I had this practice since childhood days of turning the lights on and falling asleep. So there were days when I had exposure to LED lights for 20 hours or 20 plus hours. So I reduced that 20 plus hour exposure. Now I use it only for maybe 2-3 hours in the evening. I'm even trying to, in some times, follow practices where I don't get exposed at all to light, except for only the most bare minimum light usage that I need. Same way with sunlight. If I'm getting the heat overheated from sunlight exposure, I go out in the sun only when the sun is not that intense. If it is a cool day, shady day, or if it is part of the day when the sunlight is less intense, that is the time I try to go out. Unless it is an emergency that I have to go and buy something, I don't go out. I'm not working right now, so I have the luxury of experimenting it, and there is a reason why I am not working right now. Because if I was working, I would definitely have got a cardiac arrest or any other organ systems that were getting impacted in my body. One of those organ systems would have failed, and who would dispense this information to people who don't have the time to sit and look through this information? So there was a reason, there was a greater purpose to my not working in the last few years, and to my suffering through all these things as a result of water pollution. The same things that caused death in my family. But because my death is not happening because of couple of things. I could have died from the same arsenic that poisoned my grandmother's health, that also partly poisoned my mother's. Anyone who has eaten that arsenic laced rice, everyone's health has been poisoned by arsenic for a long time. It's just that we are not aware of it. Slow poisoning. It's not the instant poisoning that happens when someone gives you arsenic. As if you have ever read the Agatha Christie novels, there are a couple of novels in her books where people died of arsenic poisoning, where they were deliberately poisoned with arsenic. But now non-deliberate arsenic poisoning is happening globally to all of us. It's just happening because we are unaware that our food has arsenic. And globally, water-based chemical pollutant poisoning is also happening. We are just unaware about it. And there is a story I had read about this in a newspaper, where someone got actually indicted for murder, but I don't think she was a murder. She did actually murder. And I will talk about that lady's case in my next video, because it was a very, it is something universe only guided me to that post, because there were certain hints in that video itself that showed that she's not a murderer. Anyways, but why am I bringing this topic is this. Let's say suddenly I die of arsenic poisoning. Is it that someone deliberately put arsenic in my body? No. If I die of arsenic poisoning and they find arsenic in my body, or if someone dies of pesticide poisoning and if they find pesticide in their body, it doesn't necessarily always mean that they died because they ingested the pesticide or they deliberately took the arsenic. It can also happen to someone if the same, look at the logic of this, that if say someone can die from 1 liter of some pesticide consumption, but if that same 1 liter of pesticide was consumed by them over micro 1 liter exposure over a long time of 30-40 years of their life, their body, and if their body is some other liver functions and other bodies elimination function was impacted because of the exposure to these 1 ml of the pesticide, that same person, one person can develop 1,000 liter of that pesticide manifesting in their blood over a period of those 10-20 years or 30-40 years of small amount of exposure. If their organ systems had started failing, they might not know it, doctors may not know it, but the accumulation in their body doesn't stop simply because they are not aware or their doctor is not aware, right? If you have been using so a farmer, sometimes they say farmer has committed suicide, but how do you know the farmer has committed suicide? What if that farmer was just not committing suicide, but he was exposed to that pesticide via the farming efforts he's doing daily regularly in his work? Maybe he died because of that. Now this difference between whether someone deliberately did suicide or whether it was because of the consequence of the job they are doing, this difference people have to start understanding, and only when people understand this difference will they understand that farmers need to stop using pesticides in their workplaces. I am not a farmer, but I still got at one point of time nearly 20-30 symptoms of pesticide poisoning over a span of a year or more of exposure to those pesticides from my environment. At that time in my home also no one was using, but in my building societies, the different places I live, while traveling in the trains, while walking on the road where municipality has sprayed pesticides, because I love walking on the roads and going to a park or just simply walking. But if that road where I am walking has been sprayed with pesticides, am I going to inhale that pesticide invariably someday? Even if that pesticide spraying had happened 2 hours back or 2 days back, this which literally happened to me, that municipality has come and sprayed in the evenings. Next day in the morning, I went in the morning to the church in the local area. I was having breathing distress. Why? Because first of all, the spraying of the municipality done on the whole neighborhood has also been coating the respiratory system of the trees in this area. So when I'm going out, even though there were the spraying had happened in the evening around 4-5 o'clock or something, and in the next day morning when I'm going to the church, or almost over 12 hours had passed. But despite that 12 hours having passed, in those 12 hours all the spraying they do around the trees and drains and all that only. So when they spray around the drain also, spray around the tree also, spray around the earth also, what is happening? All those chemicals are going into the underground water supply, into the earth and also in the air, and it lands on the trees first. And then these trees, because trees are the most unmovable thing on this locality, trees and building, so they will land in our buildings, they will land on the trees also. And these trees, now if their trees leaves and branches are coated with this chemical from regular spraying, the tree is unable to breathe. And when the tree is unable to breathe, it will not be able to give us the oxygen that we need. If there is no oxygen from the trees, then I am also not able to breathe. How can I breathe if I don't have, like, I can keep breathing, but if I don't get oxygen from the air, will I live, or am I going more towards death slowly only, because the amount of oxygen is not entering my body that my body needs? Because I can breathe whatever minimal oxygen is present in the air also, but after having breathed the minimal oxygen available in the air, if my body's functional capacity is gone now, where majority of the cells are not getting the oxygen they need to stay healthy, my that is how you get the organ damages, that is how you get the multiple organ failures, that is how you also get the blood related clotting and other problems, thickening of blood related problems that people were showing during COVID, because COVID is the last thing that killed those patients. Before COVID, all the pesticide exposure, chemical exposures that are coating their blood, coating their organs, preventing their blood and other organs from doing their regular functions, and these chemical exposures that have been happening slowly over time. Not one, that last day of toxin exposure from a virus or from some other chemical is what is causing someone to die. But before that last day of the final toxic exposure, so which is where my lungs are in not lungs, but my circulatory system is in poor health, my cardiac system is in poor health, both of which is factors that they are in poor health were present in my medical reports, but the doctor's eyes aren't able to perceive it, which I can't do anything if a doctor perceives it or doesn't perceive it. If I have to survive and I have to live, even if a doctor doesn't perceive that I am in good health or bad health, if I can perceive that I am in bad health, can I sit down and just die? Or if I have knowledge, do I have to dispense that knowledge before I die? If I have the knowledge, I have to speak. That's why I am speaking these on these videos. And not just if I have the knowledge, it's not that I haven't complained to the municipality about this, but the municipality also has to put two and two together. Just sitting in government without why is someone in a governmental setting? They are supposed to govern and look at multi-layered aspects of interconnected things that are happening, that are causing people to die. If a government just simply looks at the data of a doctor and just sees that, oh, they have respiratory problems from this virus and that's why this virus needs to be stopped, yes, you have done one part of the analysis right, but there is multiple aspects to those COVID patients also dying, and those COVID patients who have long COVID going on in their body, because even though the virus is gone from their body, the conditions that cause them to have that fatigue, causing them to feel breathless, causing those people to get intense sweating, causing those people from getting bone aches and pains, muscle ache and pain, skin irritation, skin allergy. These are all COVID symptoms. Or after the COVID patient had died, they had multiple organ failures going on, they had thickening of blood going on. All these things are happening because not just the virus, the chemicals in their environment have caused all these damages in their body. Those who died, they died because virus plus all these chemicals, they had ruined their body to such an extent they can't survive anymore. Multiple organs had failed and were near failure. That's why they died. Those who are still surviving, they are still surviving because some organs of their body are still functioning, still going through some basic functional levels. That's why they are surviving. Their blood reports might show in a superficial way that they are okay, but actually their health status is not okay if there are multiple levels of air, water, food, clothing, pollution happening in their environment. And on that I will post in the next video. My health history is involved in all this related to cancer is this, that the only way, even if I go and get a treatment from a doctor today, if a doctor finally detects that I have cancer, or if a doctor finally admits that I have pesticide poisoning going on in my body, or any other kind of chemical poisoning going on in my body, if they finally detect it, now my body's health status is at such a stage, if 3 problems are going on in my body or 5 problems are going on, they are at such a complex stage that if they give me treatment for one disease, one organ will fail or one organ will stop having side effects from the chemical given to me. Because my main problem is what? Chemical pollution in my body. Chemical pollution and exposure from multiple sources that are impacting multiple organs of my health, that are causing me to show up chemical poisoning symptoms from pesticides, chemical poisoning symptoms from daily use chemicals in our home, chemical poisoning that has eventually over the decades of exposure to these chemicals. My chemical exposure didn't start today. Only the last few years of exposure is escalating my health problem. But my chemical exposure, radiation exposures, they were happening since childhood days in different countries, different places that I have visited from different sources. Now, when at the peak time of a particular source impacting my health, the doctor couldn't detect it, but if she had detected it also, if I had got medicine for it also at that time, problem is even after getting that medication and treatment regimen, I can only stay healthy if the surroundings that are causing the medication pesticide poisoning stops the pesticide exposure. If any farmer who is going for pesticide poisoning now to a farming based community clinic and getting treatment for their pesticide poisoning, even if that farmer gets the treatment but he doesn't stop using pesticides in his workplace, or if he stops but his friends around in the neighborhood doesn't stop using pesticides, that farmer can't survive, or his survival will be these long covid like symptoms of dragging on with slow poisoning of pesticides happening. Any person with long covid, if whatever chemicals that are impacting their health aren't eliminated from their surroundings, from their neighborhood, again their long covid will continuously continue or worsen, depending on sometimes in the summer when the level of chemicals used in farming is high, level of chemicals used in homes are high. That's when many people are dying nowadays during the summer time, or closer to the times when these chemicals are being sprayed, because of the fact that those medicines can't stop anything anymore, or even if they stop, they are temporary solutions, because a medicine itself is a chemical toxin overload on a already chemically toxically loaded body. Only that medicine will save a person, that medicine which can counteract the chemical that is poisoning someone. If that medicine is given, maybe you will be fine. But if you are given a medicine that will enhance the chemical load on your body, which is already toxed out, then more harm than healing will happen. And all these distinction between discernment between what is a health risk versus what is health benefit, what is health harming now that was considered health beneficial 10, 20, 30, 40 decades back, those things need to shift if people want to live a healthy life, or if people want to even survive leading moderate quality of life right now, because moderate quality of life supporting factors are slowly dwindling from earth. And our lifestyle choices, if our lifestyle choices don't reduce the number of chemicals we use in our body, the quantity of chemicals we expose our body to, most of us are in the trajectory of really painful diseases and death. And it is not a video meant to scare you, but it is a video meant to wake you up that even though my grandmother got intervention, she died because the chemicals that were causing harm didn't stop. My mother's also health had the same issue. The chemicals and other environmental conditions impacting her health were not absent. That's why she died. My father survived, but he was lucky to survive. But now he is not going to survive if the chemicals around in his lifestyle choices, in choices made by the people who support his health, if they don't make the right choices, he can't survive. Same way with me. I am just barely surviving through this. In the last 5 years, I've been just barely surviving. But the only reason I have been able to survive is because I have been very mindful, very careful. And even before these 5 years, I was mindful and careful because I didn't have a mom to take care of my health. I didn't have a dad who takes care of his own health. So I don't have a dad who has ever taken care of my health in a way a parent is supposed to take care of. So I am the one who is surviving because of the fact, not because I have the least health problems, but despite having majority of health problems impacting many human beings, I am able to survive it is because I understand when even microtoxin levels are present in my environment, what to do, how to take care of it, in some ways because of that, and also in some ways because universe is simply helping me survive through this. I wouldn't have survived if some universal guidances hadn't helped me survive through this. And even then, I am just barely at the lowest spectrum of survival, despite multiple interventions I am practicing. because I can't survive just doing the things that one person has to do. In order for every human being to survive through what actually led to COVID, or what is actually leading to long COVID, or what is actually leading to cancer, everyone has to jointly do some efforts to stop those things. Otherwise, money is not going to help us, food is not going to help us, having fun in life is also not going to help you survive through this. Because what will you do with fun if the things that are your sources of fun are poisoned by the chemicals that I'm talking about? What will you do with money? Can money go and buy you a chemical free water and food and clothes, if no chemical free food, water, clothes, air, homes are available for you to buy? If the people who are supposed to create these food, water, clothes, anything that supports your comfort and health, if they are also dead, are you going to be able to survive even if you have lots of money, if the people required to do the work for you to have a luxurious life are dead? Does that make sense? I hope it makes sense, and if you have any questions, please drop a comment. Thank you.